Hello, everyone. Welcome to the August monthly meeting of the Youth Medical Career Exploration Organization. Today, I have the honor of meeting with Dr. Suzanne, a board-certified allergist immunologist at Family Allergy and Asthma in Tennessee, who specializes in treating allergy, asthma, and clinical immunology across all ages. Thank you, Dr. Rachel, for joining us today.
It is truly my pleasure, Ibrahim. And as I mentioned, I am so proud of you for starting this program, just so that people can get somewhat of an insight as to kind of the trail or what's going to happen if they choose a career in medicine. The other thing I would like to do is I would like to go through a couple of things, some of the lessons that I have learned along the way. And one of the things that I want to share is that who I am. I'm an entrepreneur. Owned our own business. I'm a board certified allergy, asthma, immunology expert, and I've been in the field of medicine for about 40 years. I trained for 11 years because unfortunately when you train, it takes a long time if you want to subspecialize, and that's what I did. And I retired from practice a few months ago, actually a few weeks ago, not even months ago. But I wanted to give you all kind of a snapshot of where I came from and know that there are obstacles that you may meet, but you can overcome those obstacles. So I'm going to tell you that my early years, I come from a family of 8 children. I'm 3 out of 8. And we came from very humble beginnings. So when I talk about lack, there wasn't a lot to go around. What did go around is that we had an abundance of things like love and music and ethnic families. My grandfather and grandma are immigrants from Germany. He was an entrepreneur. He was a baker and owned his business for a while. And we grew up with gratitude. And I think that when you come from a space of little or lack, then you learn to appreciate value in things, people, emotion, those types of things. So we didn't have an abundance of money, but that taught me something. It also taught me, and my family had a very strong work ethic. So as you all know, to get from point A to point B, frequently you have to work hard. And that comes from your parents mentoring you or people that you have seen. So this is one of the life lessons I'm going to suggest that you do. Choose somebody in your life who is hardworking, who has a heart for people, and you will definitely go far. Also, you need to make sure that you are on a level where you can compete, but not so that you're pushing people down as you move up that ladder, because you're going to find it's easier to get honey. Bees don't get the honey. You have to be gentle and kind and sweet, so it's easier to capture bees with honey than it is from vinegar. So keep that in mind as you continue to grow. So let's back up a second. So one of the things that I want to share is that because I came from lack financially, one of the things that I learned is if I wanted to get something, if I wanted to be successful, not just emotionally, but financially, I need to work for it. And that's where the work ethic came in. And that's what's going to happen with you all. You're going to have to learn to work hard and to select certain people in your lives that's going to help promote you. Again, growing up with love and music and culture was extremely important because that taught me, again, values of things that you don't necessarily, you may not experience or you may not have received. The other thing I want you to tell you is that there was some social issues when I went to my first 2 years of college. I went to a junior college, and there were some social issues that were going on at home. So my grades were I was not a 4.0 at that point. I worked full time after that because I didn't have the money to go to college. So 2 things that I want to teach you. Know that there are lots of monies out there. There are scholarship dollars, there's grants, there's other things that you can do. I didn't know about that when I first went to college. I learned about that later. But what I want you to do is look for those opportunities because they are out there. It may be that you have to write an essay, but there are lots of options, like I said. So don't let money or the lack of money derail you from your goals. It's extremely important. The other thing is that, so when I went to a 4-year university, I met with the guidance counselor who said, if you don't have a 4.0, you're not going to be able to get into medical school. So Ibrahim, if I had listened to that one person, I would not be a physician today. And so I slightly changed what my direction was and decided to pursue psychology, social welfare, social work, those types of things. And then I took a leave from school and I went to Australia, Hawaii, and Alaska. So I was gone for a year, but during that period of time, I became recommitted to pursuing medicine. So then I went back to Southern Illinois University, which is where I trained, and learned about a special program that was there for non-traditional students, because at that time I was 21, not the usual 18 or 19-year-old that goes into college. So also keep that in mind. If for some reason, because of family issues or other things, you cannot go to college right away, all is not lost. You can still choose that. In fact, there was a gal in our medical school class that turned 50 years old in medical school. So keep that in mind as well. Don't let those things get in the way. Don't let naysayers guide your path, because there may be one person that says you can't do it. Look for the people that say that you can do it. So that's the other thing that I want you to do. So the other thing that I should mention is that in the process then of going back, choosing this program, this med prep program, I learned about osteopathic medicine and allopathic medicine. And many people still don't know about osteopathic medicine. So there are two types of medical schools in the United States. There's allopathic medicine, where you go to school and you get an MD degree. And then there's osteopathic medical schools where you get a DO degree, Doctor of Osteopathy, versus a medical doctor. The ways that they're similar is that you can specialize. It's 4 years. You have to get good grades. You have to take your MCATs. You have to score well. The difference is that osteopathic medicine focuses on more a holistic approach and body mechanics. We call it manipulative medicine. So in the process of the curriculum, you're also taught how to do some body mechanics, which I describe it to people as kind of like a chiropractor and an MD all in one, because we're trained in multiple modalities of medicine. So if you're someone that wants to do orthopedic medicine or you want to do sports medicine, that would be the direction I would suggest you go, because if a person comes into your office, you don't have to just give them medications. You can also manipulate their body, do manual manipulation, and get them feeling better before they even leave the door. So keep that in mind for some of you folks. The other thing that I should mention, so I opted for osteopathic medicine, and I went to the University of New England College of Osteopathic Medicine in Maine, which was a great experience. And then I came back to the Midwest, which is where I'm originally from. I did a 1-year rotating internship in St. Louis because I really wanted to teach. That was extremely important to me. And what I learned is if I wanted to teach at a medical school level, I needed to do this rotating internship. And then I returned back to Chicago and did 3 years of internal medicine at Rush Presbyterian St. Luke's Medical Center, which was a big facility. Our residency program, internal medicine residency program, had 150 residents. So it was a very large residency program. I opted to stay on, but before I went to that internal medicine program, a lecturer, a pulmonologist, came to Normandy Hospital where I was training and talked about asthma and said, the treatment of asthma is completely different than the way we always thought it was. We thought asthma was treated with the ABCs, aminophylline, beta agonists, and corticosteroids. And now we've learned that it's flipped on top of his head, that the number one treatment focus is going to be inflammation. And so what that meant is corticosteroids became first-line therapy instead of beta agonists, which is like albuterol, okay? Or aminophylline, theophylline is an older medication that was used quite commonly at that time. And I was fascinated. Oh my gosh, Ibrahim, I thought, oh my gosh, we're getting here from the bottom up. So I was completely taken by that. So that's why I opted for internal medicine. Now, for anybody who's interested in allergy and immunology, I'm going to recommend they do a med-peds residency. So internal medicine and pediatrics rolled into one. It still only takes 3 years to complete it. I did a 4-year internal medicine program. I then rotated through allergy and immunology when I was at Rush Presbyterian St. Luke's Medical Center. And I became so excited about immunology. And so keep in mind, this is several years ago, more than 25 years ago. And it was just so exciting to me. I thought, oh my gosh, everything has to do with immunology. At least that was my thought process. So I opted, instead of doing pulmonary medicine at Rush Presbyterian St. Luke's Medical Center, I decided to do my fellowship in allergy immunology. And I spent 3 years there. 2 years is required, but I did an elective year because I really wanted to practice academic medicine. And then I learned that, and the reason why I want to do academic medicine is because then you can train medical students, residents, fellows, and others. And I really love teaching. So that's why I opted to consider that. So I did 3 years. But I decided that when we then ended up moving to Chattanooga, Tennessee in private practice. And what I learned is you can still train residents and medical students. And even I've had high school students come in and shadow me. And the way that I did it is a little bit different than many physicians do because I believe in hands-on. In our philosophy in the osteopathic field, you see one, you do one, you teach one. So that was my philosophy. I believed in that strongly. So when a resident would come in, I would get a sense of what they knew, and I would have them actually do the intake form, do the physical exam. I had to do it as well, and it took a lot more time, but that way they're getting their hands in it. They could feel it. And then I wanted them to come up with a treatment plan, depending on their level. If they were a first-year resident or second-year resident or third-year resident, the requirements are going to be a little bit different. And then the other thing I would do is when we would have a patient, for an example, if we had a patient that had urticaria, then I would say, or angioedema, swelling of the body, then I would say, okay, what we need to do is let's talk about angioedema. Angioedema, there's hereditary, there is non-hereditary, there's acquired. So then we would talk about that. So they would learn something in that process, which was fantastic. I love that. So that's what that's how I got to allergy, asthma, immunology. Now I should mention that when it comes to allergy, asthma, immunology, there are several areas of AI that we are experts in. And one of those, what brought me to the field in the first place, as I mentioned earlier, is asthma. And asthma, as you know, is an incurable, potentially life-threatening condition that affects millions of people, children as well as adults. And what we know now is that there are things that we may be able to do to help prevent someone from developing severe asthma. And the way we do that is we identify it, and then we identify their triggers, and then we manage it. We manage it with medications and behavioral changes, as well as using peak flow meter readings and spirometry and other things. Another area is rhinitis. Rhinitis means nothing more than swelling of the tissue in the nose. So we teach people the different types of rhinitis because some people have a runny nose because it's raining outside or because their weather changes or barometric pressure changes. Other people have a runny nose because of allergies. So then we're trained to do skin testing as well. Food allergies is one of my favorites. And I should mention, Ibrahim, that one of the things that is very characteristic about food allergies is anaphylaxis, reactions. And so that's another area that we have to be well trained in is anaphylaxis. And I'm just going to make a plug for a new medicine. It's epinephrine. It was, in fact, a year ago today, it got approved. It was launched. It's called Neffy, Neffy, which is a medication that is in a nasal spray, and it's designed to release epinephrine in the nasal passages and treat anaphylaxis, and as opposed to getting an injection. So we have learned that there are lots of things that get in the way of people using their epinephrine or going to the emergency department. So this is just a plug for Neffy. If any of you have life-threatening allergies and you need to carry epinephrine, you can use it now in a nasal spray. So those are the things that are going to be important, is that you recognize some of the more state-of-the-art treatments for these conditions and then move in that direction. Another area that we treat is immunodeficiency. So some people, they do not have adequate amounts or adequate function of their antibodies. And as a result of that, they get recurrent infections, bacterial infections that affect their sinopulmonary systems. So if they have recurrent episodes of sinusitis or if they have recurrent episodes of pneumonia, there are things that we can do. We look at those things and identify whether or not they need to be treated. Do they have that diagnosis? It used to be called primary immunodeficiency. Now it's called inborn errors of immunity. And those folks need to go on replacement therapy. We give them the very thing that they're missing. So we get donors that will donate their plasma. That's where the antibodies live. And remember, there are 3 layers. When you give blood, there's the red blood cells and the white blood cells. When you spin it down, that's the really red part. Then there's a yellowish area called the buffy coat. And then above that is an amber-looking fluid. That's where the antibodies are. And we give those antibodies to people whose antibodies aren't working or if they don't have adequate amounts of them. So that's another component of allergy and immunology. Now, having said that, I get to teach, I lecture extensively. I love the field. Now, let me tell you what's happened. Recently, I've gotten involved in lifestyle medicine because I believe that what we can do, what we need to try and do is prevent disease. And as you know, just watching from the outside in, there are a lot of chronic diseases that may be preventable. So I'm going to give you a couple of statistics, and that is 3%. There was a national health survey that was performed. 3% of the American population has a healthy lifestyle, and they base it on 4 tenets. One of those tenets is not to smoke. What? You know, how long we've been talking about not smoking, right? So no smoking. The other one is to exercise at least 150 minutes a week, but a minimum of 150 minutes a week. So, you know, do the math. 315, 5 days a week, 30 minutes, that's 150 minutes a week. So that's going to be important. The other tenet is to keep your percent body fat for men less than 20%, for women less than 30%. And the fourth thing is going to be eating a fairly healthy lifestyle. So think about that for a second. Only 3% of the US population based on this health survey, which means 97% don't. So what do we need to do? We need to educate. We need to teach people how to be healthy. And that is a dovetail to one of the other things that I have looked at, and I have given some mini lectures on what I call the 8 tenets of health and fitness, or just what the way that I put it is what every child needs, but it's what every person needs. And the first thing that a person needs is unconditional love. They need to feel accepted and loved and not judged. Some of the things that really get in the way of us being able to be everything that we can be in creating the best version of ourselves is comparison. We compare ourselves to this person or that person, and as a result, it causes self-doubt in us. It makes us feel less than we actually are. So one of the things I need for you all to remove is comparing yourself to another person. What I need for you to do is focus on your own accomplishments. There's something also called imposter syndrome. Don't know if you're familiar with that concept, but it means that you feel like if people found out that you weren't smart enough, that you weren't funny enough, that you weren't all these things, then you would be considered a fraud. Well, that again is self-doubt, knocks down your self-confidence. What you need to do is you need to build yourself up. And how do you do that? First and foremost, you surround yourself with healthy people who have your best interests at heart, because that's what you want. You want to build up. You also want to maintain a list of your accomplishments. Some people say that you look at your life, let's say you're 15 years old, you divide it into 3. So you can go 0 to 5, 5 to 10, 10 to 15. And you write down 5 accomplishments in each one of those sections. And then you put that somewhere in your room or on your steering wheel or somewhere where you can see it every day to know that you are worthy, that you matter. And the other thing that needs to be in your head is that you are unique. You make a difference in this life. There is nobody in this world like you. And you can be whomever you want to be, with limitations. I mean, you're probably not going to be a professional baseball player. Or maybe you are. But there's a good chance that you're not. So within reason, but don't let naysayers, don't let anything get in your way. One of the things that I also want to impart on everybody is how to be a high performance person. How do you do that? Well, one of the ways that I've learned to do that is through Hal Elrod, E-L-R-O-D, who wrote The Miracle Morning. And he believes that if you get up an hour before you start your day and you do 6 things, they're called savers, S-A-V-E-R-S. And I just started implementing those in my life over the last 3 or 4 years. S is silence. So silence is when you meditate or you pray or you do whatever moves you. The A is affirmations, which is another technique to get rid of the naysayers, to build yourself up, is that you want to talk about affirmations. I am lovable and capable. I can do all things. I am strong. I am courageous. And you just continue to repeat those. Put them up on your walls, on your steering wheel, wherever, on your mirror, wherever you can see them. V is visualization. Visualize yourself. If you want to be a physician, visualize yourself as a physician. If you want to live in that house, visualize yourself in that house. If you want to be more athletic, visualize yourself in that capacity. E is exercise. So you choose a form of exercise that brings you joy. Exercise is not supposed to be easy or fun. But if you find something that brings you joy, that's what I want you to use. R is reading. So you want to read something of value every day. And S is scribing, journaling. You want to write something down every day so that you're on the right path. And then you can reflect back on that 2 months later, 6 months, a year, 10 years, and you're going to see the accomplishments that you have made. And that's going to also reinforce for you feeling good. So the first tenet of everything that you need is unconditional love. And unconditional love is just that. Not expecting anything in return, just pouring. Somebody should have poured into you through your life without expecting anything in return. And that's going to be critical. Parents can do that. But if you didn't have parents who did that, you need to find a mentor in your life that can also pour into you. So that's going to be critically important. The other thing, as I mentioned, the second one is going to be those positive affirmations. You want to write out statements that make you feel better, and that's going to help you overcome negative thoughts, especially about yourself, because those negative self-talk is so detrimental to us. And we are bombarded with, social media, and social media paints this incredible picture of people that are perfect. And we know that's not the way that it is. We aren't perfect, and we have to embrace what we have when we have it. And every day we need to be reminded that we are strong and we are functional, that we are worthy, and that we are going to make a difference. And so those are the things that are going to be extremely important. The other thing that I find, the other tenet, I'm thumbing through my notes here. The other tenet is going to be gratitude. And we need to have a heart of gratitude, because gratitude changes everything. If we have an entitlement capacity or mentality, that's definitely going to get in the way of who we are every day. So we need to focus on having gratitude. And that's one of the things that you can write in your journal. And I have done that as well, that we have put in our journal things that I'm thankful for. There was this wonderful book that I read called The Blessing of a Skinned Knee. And one of the things they talked about is that rabbis would come up with 99 points of gratitude, 99 different points of gratitude every single day. Now, we don't have to come up with 99 points of gratitude, but we need to come up with gratitude every day. And it changes the wiring in our brain to start appreciating every little thing that comes along. And in keeping that in mind, one of the things that there's been a real issue about these days is body dysmorphia. People don't feel like they're thin enough or fit enough or pretty enough, or you name it, their muscles aren't big enough. And what we need to do, again, is remove that comparison and focus on what is truly important. And what is truly important and what we need to focus on is that we've got 2 ears, we can hear. We're not someone who's deaf. Later in life, my father lost his hearing, so it made me that much more compassionate about that. My mama had diabetes and was legally blind, so there was things she couldn't see, she couldn't drive. So we've got our eyes, we can see. We've got our sense of taste and smell, and if you've lost your sense of taste or smell, you know how hard it is to eat something. We also have limbs. We have arms and legs, so we can walk, we can exercise, we can help people, we can wipe away tears, we can change a baby's diaper, we can do all kinds of things because of what we have. Those are the things that we need to focus on. The other thing is purposeful and appropriate touch. Every child needs that. And an important thing is to also learn about your individual love languages. There are 5 love languages, and it's important for you to know those, because that is how a person can say they love you to you, and that's how you say you love somebody to somebody else. And those 5 languages are physical touch, receiving gifts, words of affirmation, acts of service, and then the 5th is quality time. And I would tell you, with me, I have fluctuated between acts of service and quality time. I'm also a breast cancer survivor. And so there was a time in my life that perhaps maybe I shouldn't be here, but God decided I am here, so I'm here. But the point is that quality time became extremely important to me. The other piece of information is that I've lost 2 younger siblings to cancer. So I'm especially tuned into quality time. But acts of service is when you do kind things for people and then they don't have to do those things. So my husband and I are both acts of service, which is great. But let's get back to purposeful and appropriate touch. Every child knows that. We know from the rhesus monkeys data, that's from decades ago, that the monkeys that didn't get the touch, they died, because we need that touch. And as a physician in particular, you will find that there are some people that don't like to be touched, don't like to be hugged, but even a handshake is very healing. You put your hand on somebody's shoulder and they feel your love exuding from you into them. That's extremely important as well. So another tenet is belonging and acceptance. We need to feel like we belong, that we are part of something. I read this great book called Laughing Your Way to a Better Marriage, and it was by Mark Gungor. And one of the things that he said is that one of the things that women need, they need to feel like they matter, like they are important. And what I find is not just women, men need that too. We all need to feel like we matter, that we make a difference. And if you've read any literature on suicides, you're going to find that many of suicides is because they felt hopeless and helpless and didn't feel like they made a difference in anybody's lives. And so it's extremely important that we make people feel like they belong and they're accepted in any helping field, whether it is medicine or otherwise. If you probably have heard this said, that people don't care how much you know until they know how much you care. So it's extremely important that you exude that to another individual. That is critical. So belonging and acceptance are two things that go hand in hand. And I mentioned this before, and I'll mention it again, purpose. So the idea of purpose is that you find your niche, whatever that is. And I will tell you that I believe, if you think about it, my path has been not the traditional path, and I wouldn't change it for anything. But I believe that there is a higher power in everybody's life, whether they choose to believe that or not. In my higher power, I've got the Holy Spirit that dwells in my higher power is Jesus. But I believe that God led me down the path of allergy, asthma, and immunology, and I will tell you why. I have 3 sons. I have a son. 2 of my sons have food allergies. I'm a master at taking care of that. All 3 of my sons have asthma, and all 3 of my sons have allergy. And one of my sons has a quirky type of hives that's called cold-induced urticaria, which means that if he's exposed to cold temperatures, he breaks out in hives. And that can be a potentially life-threatening condition. If he goes into an ocean and the water's freezing, he can break out in hives, but it can also affect his cardiovascular system. He can go into shock. So, oh my gosh, all the conditions that my sons have except for ADHD, I can take care of. So God led me down that path, which is why I feel that everybody has a purpose. And they may not know exactly what that purpose is, but what they need to do is walk down that road, see what brings them joy, because every person, each one of you has a gift. Each and every one of you has a gift. What I want you to do is get some quiet time and see what your giftings are. If you can identify your gifts, and then you find somebody that can help nurture that gift and help walk you in the direction that you need to go. For me, I knew that I had a gift of being able to relate to people, non-threatening, non-judgmental, and it morphed into medicine. And I've done several different things. EMT, I was a licensed EMT in Alaska. So I did that for a while. I also worked with people who had psychiatric issues. I worked with a psychiatric social worker. And so I learned lots of things about compassion and about being available. And so it's extremely important that we identify our niche so that it's a dovetail to our purpose. And that's going to be something critical for all of you trying to seek out, whether or not it's medicine, whether it's teaching, whether it's being a firefighter, whether it's being in one of the trades, any of those things. So that's exactly what I want you to think about. Another thing that all of us need is safety and security. We need to feel safe. And especially as a parent or coming home to a home, you want a place that is safe, where you can let your hair down, that you can just chill out and know that you're not going to be judged, you're not going to be threatened. You need that space, that you want to create a peaceful, nurturing place. These days, in particular, for all of you folks, it's very difficult to find a place of peace because we're bombarded with social media. Everywhere you turn around, I mean, nobody leaves their space without their phone. The phone is in their back pocket. Some people have 2 or 3. And then you get home, you're on Facebook, you're on Instagram and TikTok and all these things. We're bombarded with all this information. That in and of itself can be overwhelming. So you need to have a place of safety and security where you can just chill, not have any social media, just be by yourself or be with your higher power or whatever it is that's going to bring you joy. But you need that downtime. You need that place of peace. So you need to carve that out. Just like what I talked about earlier with the savers, the silence is extremely important and healing. And they've showed that meditation is very, very helpful to the person, because it gives you that calmness and reassurance and lets you feel you're in a place of safety, and you don't have to worry about boundaries because the environment is so safe. I talked a little bit about purpose as well. So those are the things those are the tenets that I want you to keep in mind. And I already talked about gratitude. The other and the last one is resilience. And resilience is extremely important. So in the psychology field, there is something called adverse childhood experiences or adverse childhood events. And that is if you grow up in a household where there is any kind of drug abuse, if there's anybody in your house that's been incarcerated, there's been a divorce in the house, if there's been food insecurity, all those things can cause post-traumatic stress and can cause you to have these adverse childhood experiences. And what the literature has shown is depending on the number of adverse childhood experiences, it increases our rate of suicide significantly, exponentially. So one of the things that we need to look at with that is how do we counteract that? Because there are people that have been brought up in drug addicted families, or one of the parents was incarcerated, or there was distrust at home, or every time the child was there was abuse, domestic abuse. Well, how do we combat that? We combat that with resilience. And resilience teaches us that no matter what happens, we can get through it. The other piece of resilience is, again, have key people in your life that can help get you through it. And what that means is you have a grandparent, an aunt, an uncle, a friend, somebody whose home you can go to in case there is a lot of bad stuff going on. In not Chattanooga, but in Tennessee recently, a fellow just killed 3 or 4 people, his girlfriend and her 3 children, and then kidnapped the baby. And so the question is, was there a warning sign where those children could have gotten out and gotten somewhere? Well, the point is that we don't know that. That's why you want to have key people in your life that will help develop your resilience. Resilience is the ability to bounce back. It's also the ability to know that even though negative things come at you, those negative things do not define who you are. You can go through those. You can create exactly who you want to be. That's what I am going to reinforce for you. I want you to become your best versions of yourself. And the ways that you do that is through having techniques like the Savers from Hal Elrod, or knowing that you are worthy, that you are important. Those affirmations are going to be key. Knowing that you have a purpose. Don't compare yourself to others. Have an attitude of gratitude. Know that you are as good as anybody else. You just need to put forth the work, effort, so you can achieve your goals. And the other thing I want you to do is learn how to find joy in little things, because we know that the best is the enemy of the good. So some people are paralyzed because they feel like they have to be perfect in everything that they do and that they say. And that is the enemy of the good, meaning that you are not going to accomplish the things that you need to if you are stuck because you're not perfect. We're not perfect. And so those are the things that we need to recognize, is that being good and taking those steps, those small steps, is how you're going to achieve success. You're not going to achieve success by taking a huge leap. Well, you can, but the very most effective way is to take small steps of good. Again, don't let perfection or the best paralyze you so that you can't accomplish things. Those are the things that I'm going to recommend to you.
That was amazing, really inspiring for sure. Yeah, I really enjoyed that, and I'm sure the other members are going to enjoy that. Let's just dive into some of the questions that I feel that would
Absolutely.
So, a question that I actually got from a lot of actually people, they were talking about, and actually relates to what you were talking about today. But they wanted to know, if you were a child, right? Would you basically have done anything different? Like, would you tell yourself, if you could tell your past self, any sort of advice, what would that advice sort of be?
So the question is, if I could go back in time and give myself advice of what I could have done differently, what would that be? And I would say one of the key things is that we lived in a situation in Chicago in which my grandparents lived upstairs and my grandparents, another set of grandparents, grandma, our aunt and uncle lived across the alley. So we had a very insular family. And I wouldn't change that for anything, even though we didn't have a lot of money. That was great. So I think that one of the things would have been to identify a mentor, because it was so insular. We did everything with our family. It was very insular. So I would say one of the things that would have been helpful is to be part of a youth group, whether it's through church or the synagogue or the playground or extracurriculars, is to have a group of people that are inspiring and mentoring outside of the family. Someone who you could lean on, someone who you could talk to. That would be a critical component of childhood. Because like I said, we were so insular and we had a lot of things. The other thing about that is it would also teach you differences in people, meaning that our family, my grandparents were German, my other grandparents were French Creole. So it was very ethnic, and there was definitely some strife in that. But I would say having a mentor who was open-minded, that could guide and direct your path, is extremely important. So that was one thing. And now, as a child, I may not have been able to accomplish that, but my parents may have, if they knew what we needed. My parents did a great job with us, but that would be something that I would say would have been helpful. The other thing is to learn as much as you can as a kid. My daddy was a reupholsterer, slipcover cutter, and he was an artist. I wish, and if I could tell somebody, I wish that I had spent more time learning how to sew. I can sew, but he was extremely skilled. My uncles had a tool and die shop. I wish I had spent more time down on the first level where his shop was, learning about engraving and about dyes and about molds, just because it would have expanded my mind. So to have had more exposure to other things, whether they're vocational or they were academic, that would have been helpful. And that is something that a parent needs to implement. That's hard for a kid to implement, but I would say that would have been one of those things. The other thing is to encourage your child, find out what your child's gifted at. I was very athletic, but when I was growing up in Chicago, they didn't have women's sports. So now that's not an issue, but I would encourage them to try all kinds of sports. Can you believe it? You can get a scholarship for fishing these days, a scholarship for college, a 4-year scholarship in fishing. So it's finding things that you're good at that can help catapult you to the next level. So that definitely would be another thing. Try all kinds of sports. Try the Beta Club. Try the UN. They have these, it's called Odyssey down here. There's lots of different names for it, but things that you can try and see that if you are good at those things. They have debate clubs. They have opportunities where you can join other clubs. So we joined some of the clubs when I was in high school. So you want to just see if any of those things resonate with you. Try everything that comes your way, and also seek out other opportunities and learn what other people's giftings are and see if that resonates with you. So that would definitely be one of those things.
For sure. And then going into sort of the medical side of your job, some students were wondering regarding, as being a current high school student, would there be any specific classes or internships that you would recommend for students considering your sort of field?
Yeah. So again, the question is, are there any specific areas, internships, or other things that a person could get involved in at this level of high school? And the answer is yes and yes. The first thing is to identify where your passion is. Where are your gifts? And then you want to seek out that mentor. And the mentor may not knock on your front door, so you may have to seek them out. For an example, if you are interested in medicine, then what you want to do is most likely you have a physician in your family. Not in your family, but you have a physician that you go to, that you have access to. Mm-hmm. So talk to that physician and see where they got their start, how they got interested in that, and what you can do to learn about medicine. And then ask them what are the different areas of expertise. This is a very, it's allergy and immunology isn't the largest subspecialty, but it's a very needed one and extremely important. Dermatology is a great one. Now there's one that's, I told you I'm interested in lifestyle medicine.
Yeah.
So see where your giftings are. And sometimes it'll be led with what kind of conditions your family has. For an example, if you have someone in your family that has thyroid disease, then you may want to learn about endocrinology, how to treat thyroid disease. If you have someone in your family that has mental illness, you may be interested in psychiatry. So you want to seek out that person, learn what you can, and there's so much information on the internet. You can just Google anything, but be careful what you Google. I want you to go to reputable sources like Johns Hopkins, Mayo Clinic, Cleveland Clinic. Just don't go to AI, because AI has a lot of misinformation. So those are the things you want to do, and then seek the experts out there, and they will help guide you in what you want to do. The other thing is that you may not have a great bedside manner with people. So another area is going to be radiology. Radiologists don't necessarily have a lot of one-on-one, or pathology. So you want to look to see where your gifts are, and it may derail you, or you may choose not to pursue an area of expertise where you need to have a good bedside manner. So those are going to be some of the things. What classes can you take? Be as well-rounded as possible. And that's extremely important. And these days, if you are trying to apply for a college, university, any kind of program, you want to see what those requirements are. And I would seek that ahead of time. The other thing that you want to identify is what is needed. How much community service is needed? How much volunteer time do I need? So you want to seek out the information so you can get that on your resume before you do the application process. Also, when it comes to high school, my sons went to a private school, and the private school had AP classes in them. And I would recommend that people do the baccalaureate program, the dual enrollment versus the AP classes, because some universities do not accept the AP classes. So here you've done the AP class, you take the exam, you get a 3, 4 out of 3 is an acceptable, 4, 5, or 6 is your score in the AP classes, and the university you choose doesn't accept them. Well, you wasted your time. Well, not really wasted, because you learned something, but if you were dual enrolled, most of the time those credits will transfer. So that's a little pearl of wisdom as well for some of you students. So that's one thing to keep in mind as well. And that's going to be another resource, is your high school professors. So if you have high school faculty, you want to ask them, what are some of the areas, ask them, what do you think my gifts are? And what area do you think is a good area for me? The other thing I should mention is there are programs in the United States, they're pricey, but they can also gear you to career opportunities. You take a very long exam, and it will tell you where your gifts are and what careers would be well suited for you. And that would be a good thing to do. The other thing that's extremely important is that you don't necessarily want to do what your parents want you to do. I have talked to people who said the reason why they're in medicine is because their parents want them to be in medicine. And guess what? They're not happy, and haven't been happy for 30 years. Why be in a field that you're not happy, you're not thriving? You want to bring joy, and you want to show people, oh my gosh, because when people see me doing medicine, they go, oh my gosh, you clearly love what you do. You have a lot of passion about it. And that's what I want people to see. So that's going to be another key thing. Again, don't do things because other people are telling you to do it. Do it because you have peace about it within yourself.
And to wrap things up, I had actually a lot of people interested in sort of AI aspect, how it's like evolving, and now it's like being introduced in the medical field. So I wanted to ask you, how do you see the introduction of AI sort of affecting your field?
So in terms of allergy, asthma, and immunology, I see AI as extremely beneficial. I think that, and the reason being is because so much of what we do has to do with our brains. You have to see the person, you have to touch the person, you have to look at this rash. Yes, you might be able to scan somebody and it's going to come up with a differential. We've got this wonderful app on our phone. It's Google, where you can go on your Google browser, take a picture of something, and then it shows you. I had a friend that sent me a picture of the rash. I took a picture of it with the Google, and it came up with 60 different things. And that's not really helpful. So I think that once it gets a little fine-tuned, it will be helpful for those kinds of things. But you need to be able to ask the person, is that burn? Does that itch? Did that, all those things? And then you may be able to take that information and put it into a template, and it may be able to spit out some diagnoses. I think in that regard, it may be helpful, especially because I see people that have conditions where there is no diagnosis. And there's so many other, again, immunology, it seems like every other month they're discovering another immune issue, another immune deficiency that gets labeled because they're finding all these defects at a cellular and a molecular level. So I think it's going to be extremely helpful for someone like me. It's not going to replace physicians. Physicians will always be needed because, again, there are some things that AI is not able to, doesn't have the feelings, is not able to process through and spit out an answer. So yes, AI, I believe, is going to be helpful. Now, let me give you an example. One of the things that they've shown over and over again is radiologists. So AI, with AI, they scan a mammogram, for an example. They are going to get it correct more frequently than a radiologist. Why? Because AI is going through millions of scans, where the radiologist, even if they have 30 years experience, they're only going through thousands of scans that they're remembering in their head. So I think it is going to be extremely helpful, and I don't think it's going to replace interventional radiologists. There may be some radiologists that it may not be as lucrative because they can just plug that image in and it's going to spit out an answer. On the other hand, you still have to come up with a differential diagnosis, and if AI can do that, great, but you've got to narrow it down to what are the 3 most common differential diagnoses based on your experience. But if you're an interventional radiologist, you still can't program a robot to, put a line in somebody, or to put a central line in, or to put a pipeline into their heart. Or into their vessel. So there are things that AI will not be able to replace. But I think that with guardrails on AI, I think it could be very helpful in medicine.
And yeah, I just honestly wanted to thank you so much for your time today. The insight and all the inspiration that you've given today really, for sure, not only struck with me, but it will for sure stick with the other members. Just wanted to thank you so much for this opportunity. Pleasure to host you, and I'm sure the other members are gonna, truly remember this meeting.
Great. And Ibrahim, I will tell you that if your group wants to hear me lecture about allergies, asthma, urticaria, I told you about that strange cold-induced urticaria, food allergy, angioedema, any of those things, I'm happy to do it. I love teaching.
Perfect. Thank you so much. I'm going to for sure be giving your email out if any student has any extra questions. Just wanted to thank you again.
Absolutely.
Yeah.
You're so welcome, Ibrahim. I am super proud of you. You're going places.
Thank you so much.
You're welcome. Have a great day.
You too. Have a great day.
Thank you. Bye.